rehabilitation after shoulder surgery, or even for just, treating shoulder pain. So general principles of rehabilitation are, you want to regain as much motion as you can in the joint, as much strength and then stability as you can in the joint, right? And then you want a pain-free function of your joint. You come in, we see you, we send you to therapy. Before surgery, those are the things they're trying to achieve, right? Is maximum strength, maximum stability, pain-free use of your shoulder. And they do that by building up strength, okay, in places that you're weak, changing movement patterns, and stretching out things that are tight. In the shoulder, often you can have people that are tight, but most of it's building up strength. And a big way to do that, make sure you're eating plenty of protein. That's something I stress for, up to 2 to 3 grams per kilogram for men and women. So women, I try to keep it simple. Regular sized woman, I say, listen, 100 grams of protein will do it. For men, I say try to keep it at 150 or higher. Try to supplement if you can to try to get to those numbers. But a lot of it is building strength and exercising in a way that doesn't cause more pain. That's the hard thing, is that the people come in, they're like, well, I'm going to the gym, I'm working out, it kills me. How can I get stronger? Well, it's doing it in a very graduated way. And so after surgery, often we don't jump right into strengthening. We're just working on gentle stretching and certain movements. And then as you progress in your rehabilitation, depending on the surgery, okay, typically 2, 3, 4 months down the road, we start to add in more strengthening, get you into like your activities, what you're normally doing, to where hopefully by 6 months, okay, you're like the vast majority of our patients, where you're back to doing everything you did before this even became a problem for you, without having the pain that you did, right? So that's the goal for me, is to get everybody back by that 4 to 6 month mark, right? 4 to 6 months. We kind of see how it goes with people. Like we kind of cheat things. I wouldn't say cheat, but we just, everybody recovers in a different way. And if people are ready, they're ready. And everybody's ready to do certain things at different paces. There are some general guidelines that we see, but there's a lot of variation within that from each individual. So, but again, it's, you need to talk to the therapist. And I think therapists have people are like, oh, I want to go to my trainer. And I'm like, well, go to your trainer, but like go to the therapist too, right? Because physical therapists are incredibly valuable resources to teach you how to exercise, give you the right exercises, figure out where you're weak and where you need to get stronger, where you're tight and you need to get looser, or you're doing this way and you need to change it in order to not have the pain you're having.